are still in the midst of this pandemic. The most recent San Antonio COVID dashboard reads that we are at a moderate risk level and we are improving. But with the winter months still on the way, it seems like we are still far from done with this virus.
So joining us in today's Leading SA segment is Dr. Robert Leverance with UT Health San Antonio. Thank you so much, Doctor, for making time for us this morning.
Thanks for having me.
What percentage of San Antonio would you like to see get vaccinated to reach the idea of herd immunity? And if we do reach that number, what does that really mean?
Great question, Max. Right now, about 2/3 of San Antonians are vaccinated, so we're making really good progress. But with Delta virus, it's not quite good enough. We thought we could have reached herd immunity with 2/3 before Delta, but Delta is much more infectious. So I would say we need to get up near 90% vaccination rate. And what does herd immunity mean? It means that so many people are immune to the virus that it cannot spread so rapidly and turn into a crisis like it has here. So eventually we'll get there, but the sooner we get there, the better.
If we do and when we do get to herd immunity, is it going to be something like where COVID's always here, kind of like the flu, where we have like a COVID season along with the flu, but maybe just not as many hospitalizations or deaths?
Right. Most experts say that, COVID's not going to leave the planet. It's here and is now part of the human condition, similar to the flu. But the good news is that if we could tame it, if you will, like we've done with the flu, then we can live with it, get a COVID shot once a year, and otherwise live normal lives.
And we have seen our vaccination rate tick up throughout the last couple months. Do you forecast another wave of the virus in the winter or in the spring?
Well, it is concerning. We know that cold virus is like cold weather, and we're going into another winter. And I'd say some factors are aligning that could pose a bad winter surge. We don't know that for sure, but we had a bad surge last winter, and yet school was not in session, and yet it is in session this year, where 20% of our population is mingling indoors, mostly vulnerable and unvaccinated. In addition, we've had a late summer surge, and so that can act as a biologic springboard, if you will, for a surge this winter. Of course, the higher our vaccination rate is, the less likely we'd have that surge. And so I do want to put a plea out for folks that haven't been vaccinated yet. First of all, I think it's well known by now that this crisis is the worst crisis this nation has ever suffered in terms of lives lost, more than any prior war or any pandemic. Yet if you look outside, you wouldn't know it. It's deceiving. Things seem pretty well. And so for those who've been unvaccinated, I could understand you want your questions answered, or if you have some doubts, I think that's very fair. What I ask is this. I just ask that you speak to a trusted healthcare individual that you know, whether it's a nurse in your clinic or your doctor, or even a healthcare worker in your community or church. During normal times, we trust our well-being, if not our lives, to these individuals. And I just ask for this question, we would trust them with this question as well.
So Dr. Leverance, booster shots are becoming more available and more popular. So what is your recommendation, and when should people get their booster?
Boy, with each step of this pandemic, it gets more tedious and complex in terms of the vaccines and now the boosters. Right now, the Pfizer vaccine is approved for boosters for people over the age of 65, people with certain chronic medical conditions, including just being overweight. That's a lot of people. And then finally, people who are in high-risk occupations, such as teachers, first responders, healthcare workers, grocery store workers, and the like. So not everybody is eligible for a booster right now. Again, it's only for those that have had the Pfizer series, but a lot of people are. I would say the best way to stay on top of it is just to monitor the CDC website. That's the source of truth, and it's very available on the web.
Now, there have been two big pieces of news this week. We know about the possible antiviral pill from Merck and a setup meeting with the FDA on children's vaccine shots. What can you tell us about these two different topics?
Those are both very exciting, Max. First, for the vaccine availability for children 5 to 11 years old, Pfizer has submitted their data to the FDA. The FDA will be reviewing it. Soon, Pfizer will request a formal emergency use authorization. So we're hoping by the end of this month or early in November, we'll have vaccines available for children. And that's important because, once again, they represent 20% of the population, and now they're gathering indoors every day during the week. So this is important. And once it's available, boy, it'll be important to get our kids vaccinated. The other important matter that you just mentioned is the new pill that looks like may be available to treat COVID. And that's being put out by Merck. They indicate that they're going to pursue an emergency use authorization as quickly as they can. The studies they did showed it reduced hospitalizations by 50% and death even more. So that could be a real game changer if we had a pill to treat COVID. I think for those that are hesitant to get the vaccine, they may not want the vaccine when they're feeling well, but I think they'd be likely willing to take a pill when they were feeling poorly.
Well, Dr. Leverance, thank you so much for your time. Always a pleasure answering all of our questions. And for our viewers watching this, you can watch the full interview later this morning on KSAT.com. Thank you, Doctor.
All right. Thank you.